As we mentioned, with vaccinations down, variants spreading, there's now widespread consensus that achieving herd immunity is unlikely for us. An editorial cartoon by the artist Bill Bramhall lays it out pretty well. We'll give you just a minute to take it in here. Suffice to say, herd immunity, the message is, may be an impossibly long slog for our society. New York Times was a bit more serious, putting it this way, quote, scientists and public health experts are coming to the conclusion that rather than making a long-promised exit, the virus will most likely become a manageable threat that will continue to circulate in the United States for years to come, still causing hospitalizations and deaths, but in much smaller numbers. So, back with us tonight, Michael Osterholm. He is a professor and the director of the Center for Infectious Disease Research and Policy, University of Minnesota. He was also a COVID advisor in the Biden transition team. Thank you very much for coming on. What would life be like with herd immunity? And is it your determination that we're going to miss that brass ring as a society?
Well, first of all, herd immunity has actually come to mean a lot of things to a lot of different people. And I think if you lined up any 10 different people in this business, they'd have 10 different definitions. But the bottom line is what it means is that when you have enough protection in the community, in other words, reactor, immune people, that you start to shut down the transmission. You just can't, there's nobody to transmit it to. And that has always been a theoretical value that says at this point, 85, 90% of the population is immune, then basically you won't see transmission. Now, that varies with each infectious agent. I've worked up major measles epidemics in a state like Minnesota where we had 92% of the population immune against measles, but it was so infectious it still hit that 6 to 8% that otherwise were connected by neighborhoods or social groups, etc. What we're at right now with this virus is a situation where we don't need to hit herd immunity to have a major impact. The last 100 days has been nothing short of a modern medical miracle. I was on that Biden-Harris transition team advisory board, and we used to debate, was it even possible to get 100 million doses of vaccine out in the first 100 days of the administration? Well, they got 220 million doses out in that time. And I think that has had a tremendous impact in taking off the table a major surge of cases in this country. So the bottom line is we won't get to herd immunity. We have too many people that aren't getting vaccinated. The vaccines are not 100% effective. The variants are now more infectious than the previous ones were. But we don't have to get to herd immunity to get to a new sense of a new normal.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.